Okay, let's try this again. So I'm back. I think I'm going to use YouTube as, I know that it'll be public, but I think I'm going to use it as a kind of a journaling tool for myself for this weight loss thing. I'm going to give a brief history of where I'm coming from and then what I'm hoping to use this for. I've been overweight all my life. In 2009, I decided that I was going to have gastric bypass surgery. So I went to my doctor. We had it all set up. I was doing the 6-month pre-op stuff, going through all the classes that I needed to take, and was scheduled for surgery for March 29th, 2009. The 2 weeks before surgery, I had gone on a complete liquid diet, was ready to go. March 27th, I got a phone call from the doctor's office from my surgeon saying, sorry, your surgery has been postponed. And you take somebody who's been on a liquid diet for 2 weeks and tell them, oh, sorry, now you're not having the surgery that you've been waiting for 6 months. Waiting for longer than that, but been scheduled for 6 months. Now you're not having it. I was not happy, to say the least. So I canceled it. I was like, you know what, I can't go through this again. And at that point, I actually became honest with myself and started seeing a counselor, and I'm glad that it worked out the way it did, because had I had my surgery, I could have caused myself some major medical issues. I have been diagnosed about 1.5 years ago, maybe a little longer. I was diagnosed with BED, which is binge eating disorder. It is different from bulimia. Bulimia is where you binge and purge. BED, you only binge. I have been in treatment, and I am now a year and a month, or about a month, maybe a little longer. I'll have to look at the calendar. I know it's been over a year, binge free. However, I'm still having issues with some overeating, but no binging. So now that I am recovering from binge eating and am able to identify my triggers, and I'm doing really well with that, I'm ready to take my next step, which is to focus on the weight loss. Stopping the binge eating, I have not lost a lot of weight, only because I still don't eat the healthiest things, and I'm still overeating during my meals. I'm just not consuming what they consider a large amount of food during a short amount of time to be classified as a binge. And the difference between my overeating and my binging is my binging I did in private. It could be 6, 7, 8,000 calories at a time, till I was nauseous, till I passed out. It was full on meals in the middle of the night. It was a mess. So now it's time for me to continue to work with my therapist on the binge eating, but as well as working with my doctor, my therapist, and a dietitian on getting the weight off and losing the weight and doing it healthily. And yes, there's still that voice in the back of my head that sorry, talks about discussing with my medical team the possibility of gastric bypass. I'm not sure I want to go that route. But it's a possibility, and as long as I can keep the binging under control for an extended amount of time, I think that could be a good possibility. Right now I'm just focusing on just doing it healthily and getting my eating under control, as far as not eating the negative foods or the things that I shouldn't be consuming a large amount of. I don't want to do any restricting, as the restrictions can also trigger my binge eating. So that's where I'm coming from right now. I'm working on getting a digital scale. Right now I have one of those dial scales, which works fine, but I'd like, for this purpose, to be able to video with a digital scale. So I know at this point I'm between 286 and 290, maybe 292. I'm hoping to have a scale this weekend so that I can get started on that and get it posted, because I need I need that to be there so I can watch it and maybe influence others to join along with me. So that's where I am at right now. I'm hoping to post maybe 1 or 2 times a week, maybe more, and I'll video off and on during the week, so you might get compilations of videos during those 2 or 3 times that I'm posting. So yeah, so it's good to be back, and I will talk to y'all later. Bye.